So Kerryn, there are some concerns that it's not quite yet safe to go back to school in Canberra. How would you reassure parents and staff that it is indeed safe to do so?
Yeah, thanks Vanessa. In the ACT we're actually in a very good position at the moment. There is no evidence of community transmission and we have had very, very few cases over the last month and all of those have been acquired overseas. We also know from research in Australia that there is very limited transmission from child to child as well as child to adult within schools. Students who are aged 3 to 19 or people who are aged 3 to 19 also have very, very low rates of illness both in Australia as well as in countries overseas. And I guess in school places, the greatest risk of transmission is from adults to other adults. So the most important thing is for adults to maintain their social distancing of 1.5 metres from other adults. So Vanessa, what can people do to reduce the risk of transmission for both staff and students within schools?
Well, I think, Kerryn, we're really entering a new normal here with staff and students returning to school and other people returning to workplaces. The most important thing to do is stay away from school if you're a staff member or a student and you are sick. That's the absolute first point. The second point is that we've got to continue to maintain the really good hand hygiene and cough hygiene practices that we've got so good at in the last couple of months. And finally, for the adults, they need to maintain their social distancing with other adults in the school grounds. So we don't want to see parents congregating outside the classroom, staff when they're in the staff tea room, they need to keep their distance, 1.5 metres from one another.